Thank you, and good afternoon, everyone, for joining this. Thank you for joining this most important webinar, a pre-summit event of the Nigeria Economic Summit Group for 2024. In this meeting today, we're going to be looking at the subject matter of strengthening healthcare regulatory bodies in Nigeria. My name is Dr. Ayodele Cole-Benson, and I'm going to be your moderator today. I am the thematic lead for Health as Business Thematic Group at the NASG Health Policy Commission. In today's event, we're going to have this sequence. So I'll go through with the introduction very quickly. And soon after the introduction, we're going to have the welcome address. And following the welcome address, we'll have the keynote address, and then we have the context setting in that order before going into the panel session. Permit me to just intimate you about the Health Policy Commission of the Nigeria Economic Summit Group. It happens to be one of the 12 policy commissions at the NASG. That is the Health Policy Commission. It's one of the 12 policy commissions that we have. And in this policy commission, we do have two thematic groups, the Health as Business Thematic Group and the Public Health Thematic Group. Altogether, we have over 40 thematic groups at the NASG. But today we're focusing just on the Health Policy Commission and this event, strengthening healthcare regulatory bodies in Nigeria. We do have a steering committee that functions as an advisory board to the Policy Commission, and we have the commission led by the facilitator, who in the person of Dr. Maurice Atoki. I will introduce her in a bit. And each of the thematic groups are led by thematic team leads and co-team leads. Like I said, I'm the team lead for the Health as Business Thematic Group, and we have Dr. Obinna Newihe as the co-thematic lead of the Health as Business Thematic Group, while we have Dr. Maria Saleh as the thematic lead for the Public Health Thematic Group. Now, let me just take a brief introduction of Dr. Maurice very quickly, who happens to be our facilitator at the Health Policy Commission. Dr. Maurice Atoki is a prominent leader in the field of health development and sustainability, currently serving as the CEO of the African Business Coalition for Health, ABC Health. Her career is distinguished by profound commitment to improving health outcomes and promoting education across Africa. She had worked previously before now at PricewaterhouseCoopers, that's PwC, where she led the sustainability and climate change team. At ABC Health, she's played a lot of instrumental roles, fostering partnerships and collaboration to enhance healthcare access and quality across Africa. ABC Health advocates for joint effort partnerships and dialogue, and multi-sector alliances, while selecting technical partners to deliver on results. So Dr. Toki is a leader in the Health Policy Commission, and at some point, she's going to be taking the closing remarks right at the end of the meeting today. So without much ado, I'm going to make welcome our first speaker for the day, who will be giving us the welcome address in the person of Dr. Uyebanji Filani. Dr. Uyebanji Filani is a global healthcare leader and a medical doctor for over 17 years in health system reforms. He currently serves as the Honorable Commissioner for Health and Human Services in Ekiti State, Nigeria, and he is the chairman of the Nigerian Health Commissioners Forum, where he also, in that capacity, guides, colleagues, his colleagues in health system reforms and strengthening at the sub-national levels. So he will be giving us the welcome address in today's event. Now, why are we talking about, strengthening healthcare regulatory bodies in Nigeria as a need in our nation at this moment? Because when you look at if you look at the industry, at the national level, we have lots of regulatory agencies from NAFDAC, the National Agency for Food and Drugs Administration and Control, to the Medical and Dental Council of Nigeria, to the Pharmaceutical Council of Nigeria, Nursing and Midwifery Council of Nigeria, Medical Laboratory Council of Nigeria, Federal Ministry of Health, the Nigerian Nuclear Regulatory Authority, and so on at the national level. At the sub-national level, you have, the State Ministry of Health and other agencies like HIFEMA in Lagos, that play regulatory roles. And when you look at that landscape, filled with regulatory agencies, each of the agencies are, operating suboptimally. We are not having the coordination that is required to make things more, efficient. And that's why we're having this webinar today as a pre-summit event to look at ways we can strengthen the healthcare regulatory bodies in Nigeria. So thank you for coming into the meeting this afternoon. And I will then pass on the mic to Dr. Oyebanji Filani to give his welcome address. Thank you. Over.
Thank you very much, Dr. Ayodele Benson, for the introductions, and thanks to Maurice and the entire team for putting together this event. Heads of ministries, departments and agencies, captains of industries, heads of association, donor communities, ladies and gentlemen, on behalf of the board and management of the Nigerian Health Economics Summit Group, I'm delighted to welcome our distinguished and erudite panelists and our highly esteemed participants to this pre-summit event titled Strengthening Healthcare Regulatory Bodies in Nigeria, hosted by the NESG Health Policy Commission. This is one of the pre-summit events of the 30th Nigerian Economic Summit with a nice hashtag NES-30. This is being jointly organized by the Nigerian Economic Summit Group and the Federal Ministry of Budget and Economic Planning. The pre-summit events are geared towards engaging stakeholders in a series of virtual conversations and sessions in the weeks leading up to the 30th Nigerian Economic Summit. This year's summit will hold from October 14 to 16, 2024. If you have not registered, kindly go to 30.nesggroup.org to pre-register now. The importance of a strengthened healthcare regulatory body to all individuals and businesses cannot be overemphasized, as it plays a significant role in the safeguarding of public health and ensuring the quality of healthcare services delivered across the country. In Nigeria, with a population exceeding 200 million, we have a significant number of challenges in the health sector. And often, the role of the regulatory environment ensures that we're able to move in the right direction. Regulatory bodies need to have done quite a lot of work in ensuring that we can oversee healthcare operations and improve compliance, but certainly more needs to be done with better improved adequate resources and ensuring that we can strengthen enforcement capabilities and move on to legal frameworks that are fit for purpose in the 21st century. These deficiencies sometimes can have far-reaching implications, contributing to a proliferation of unlicensed medical practitioners, substandard healthcare facilities, and unsafe medical products. Such conditions not only compromise the quality of healthcare services, but also undermine the public trust and deter much-needed investments in the health sector. The repercussions of regulation that are not great are always stark. For example, increased healthcare costs, preventable morbidity and mortality, and a widening disparity in healthcare access and quality across the country. Addressing all of these challenges require urgent and coordinated efforts to strengthen regulatory bodies, enhance their capacity to enforce standards, and foster an environment conducive to sustainable healthcare development. If we take a look at all of these issues from an economic lens, a healthy population is essential for economic productivity and national development and stability. Thus, the need for effective healthcare regulation to contribute to a healthier workforce, which in turn reduce absenteeism from work, help to reduce preventable diseases, and enhance productivity is critical. Strengthening healthcare regulatory frameworks underpin sustainable development, supports economic resilience, and promotes regional integration, thereby contributing to overall socio-economic advancement and improved quality of life. Hence, the NES 30 pre-summit event on strengthening healthcare regulatory bodies in Nigeria seeks to explore evidence-based approaches and best practices, as well as foster dialogue and collaboration among relevant stakeholders to ensure the strengthening of healthcare regulatory bodies in Nigeria. Addressing a multifaceted issue regarding healthcare requires the collaborative effort of everyone, including not just government officials and regulatory providers, but also healthcare providers, the academia, the private sector, to make sure that we're able to formulate and advocate for the right set of reforms. On this note, I warmly welcome my dear brother, the keynote speaker, Dr. Abdul Mokhtar, the National Coordinator for the Unlocking Healthcare Value Chain Initiative. I thank him on behalf of the NESG for finding time to speak at this event. I extend our profound appreciation to our moderator, our esteemed panelists, and every participant for accepting our invitation to share your knowledge, experience, and insights on strengthening healthcare regulatory bodies at this event in the interest of the nation. I urge you all to zestfully contribute and share insights to ensure that the benefits of a more robust healthcare regulatory system in Nigeria are widely shared. And finally, once again, I implore everyone who is listening to register for the 30th Nigerian Economic Summit through the NESG website to join other experts and stakeholders to articulate an agenda for collaboration, collaborative action for growth, competitiveness, and stability. May God bless the Federal Republic of Nigeria. Thank you all.
Yeah, thank you, Dr. Filani. Thank you so much for your welcome address. I want to quickly introduce Dr. Abdul Mokhtar, who will be giving us the keynote address. Dr. Abdul Mokhtar was appointed the National Coordinator of the Presidential Unlocking Healthcare Value Chain Initiative under the Federal Ministry of Health and Social Welfare in 2023. His previous experiences include serving as the Director of Industry and Trade Development at the African Development Bank. His career also includes a pivotal role as the group's Chief Strategy Officer at Dangote Group, where he facilitated a significant expansion across multiple African countries as the CEO of the Abuja Investment Company Limited. So Dr. Abdul Mokhtar holds a doctorate in biotechnology from Boston University, USA, a master's in business administration from Harvard Business School, USA, and a master's in public health from Harvard's Kennedy School of Government, and of course, a medical degree from Ahmadu Bello University, Zaria. Thank you, Dr. Mokhtar, for making time to join the conversation today. Please, over to you to give us your keynote address. Thank you.
Thank you, Dr. Benson, and good afternoon, everyone. I hope you can hear me and see me very well. So I want to stand on existing protocol, but also want to recognize, the organizers of this important dialogue, the leaders of the thematic groups, yourself, Dr. Benson, Dr. Maria, and other conveners of this roundtable. His Excellency, the Honorable Commissioner, Dr. Filani, my dear brother. Thank you for all the good work you're doing at state level and really trying to bring coordination, across the entire health sector between federal and state governments. We really appreciate your leadership. My dear sister, DG NAFDAC, Professor Adeye, I see you here, and other distinguished ladies and gentlemen. This is a pre-summit. And again, as stated by Dr. Filani, this is actually a lead up to the main event in October. And the theme for that event coming up in October is collaborative action for growth, competitiveness, and stability. I want to start by situating the healthcare sector within this overall agenda and how important it is that healthcare becomes one of the sectors for key consideration in this upcoming summit. You cannot have growth, sustainable growth, without a focus on the healthcare sector. In many countries across the world, the healthcare sector is almost about, in the US, for example, 17% of the GDP. In Europe, about the same 15 to 20% of GDP, depending on the countries. In Nigeria, the sector accounts for only 3 to 4% of GDP. So when you're thinking about growth, whether it's economic or social growth, the health sector is one area where you absolutely can achieve that kind of growth. When you talk about competitiveness, you cannot be competitive as a nation without a deliberate focus on human capital. And human capital, of course, healthcare is one of the key components of that. Education and other, social sectors comprise that. So again, linking the theme, the healthcare sector is really at the center of the agenda for this year's summit. And then finally, when you talk about stability, you cannot have a stable nation, again, without having a robust and effective healthcare delivery system. So all of this to say that the healthcare sector is actually a key component and is central to the theme of the upcoming NES 30, which is also a landmark summit for the Economic Summit Group. Now, within the government, as you know, there is the Renewed Hope agenda that is being implemented nationwide, covering all sorts of sectors. But within the healthcare sector, the government is implementing a healthcare reform program, which is anchored on 4 pillars. And I'm sure many of you have heard these pillars before, but I just want to restate them just for the sake of those who might not have. And the overall goal for this transformation in the healthcare sector is to save lives, reduce both physical and financial pain, and produce health for all Nigerians. So again, life-saving is a key component, reducing pain, physical and financial, and also just bringing everybody into the sector, for everybody. And this program is a 2023 to 2026 agenda strategy to implement this. And the 4 pillars are the first one is governance, effective governance. Dr. Pilani mentioned the need to coordinate, what's going on, so in Nigeria, of course, you have the federal, you have the states, you have the local governments, so bringing everybody together, but you also have all these donors and partners that are trying to do good in the healthcare sector. So one of the key objectives of that pillar is really to bring everybody together in a transparent manner so that everybody's accountable and there is an effective coordination. The second pillar of the healthcare reform agenda is the bringing about improvement in population health outcomes. Sadly, as we all know, when you look at Nigeria, many of the indices, whether it's maternal mortality, child mortality, and those kind of other health indices, in terms of disease burden in various disease categories, Nigeria is really at the top of the table without, sadly, as I said. So the second pillar is expected to really just address this hands-on, tackle, through primary healthcare provision, through the provision of health insurance, making sure that there is equitable and access, is also, the scope of access is widened across the country, so that we can address many of these target disease areas effectively. The third pillar, which I'm going to elaborate later, is unlocking the healthcare value chain. And then the last one is really just making sure that there is health security, so focusing on resilience, focusing on preparation for pandemics, in case, there is a next COVID that comes. So how do you build resilient and robust health systems to address that? There are cross-cutting pillars that cut across all of these pillars to bring about a unified system. Regulation is one of them. So regulation and the need to have strong regulatory bodies is actually one of the key cross-cutting pillars across all of these pillars in the healthcare strategy. The others include financing, digitalization, using technology to bring about efficient and effective healthcare delivery system. Now, with regards to the third pillar that I mentioned, unlocking the healthcare value chain, which I coordinate across the country, the key components are one, stimulating local production of health products. Second, shaping markets to ensure sustainable local demand for products, creating, incentives for manufacturers, strengthening supply chains, and then promoting clinical research and development. As you can see, all of these require some form of regulation to make sure that the regulation is effective. So for those who are not really aware, the Presidential Initiative to Unlock the Healthcare Value Chain was created, established by His Excellency President Bola Ahmed Tinubu in October of last year. It's comprising 20 agencies, including about 5 ministries, including health, budget and planning, digital, ICT, industry and trade, and so on. But the most important thing to note is that the key regulatory agencies are also part of this initiative. So NAFDAC, Pharmaceutical Council of Nigeria, Standards Organization of Nigeria. And this shows that there is a clear understanding that effective regulation in this sector is really critical to enhancing that improving local production of commodities. We have 3 KPIs in the presidential initiative. The first one I mentioned is increasing local production, as we know. Sadly, in Nigeria, we import maybe about 70 to 80% of the pharmaceuticals that we use. Almost 100% of the vaccines that we use. We are a Gavi country, of course, so we don't produce any. We receive from some of the key organizations that supply this. And then medical devices, almost 99% are imported. So one of the key objectives of the presidential initiative is to revise these numbers. We have very clear targets that by 2030, we'll be able to revise these numbers. So the goal for 2030, for example, is to be able to produce at least 70 to 80% of the pharmaceuticals that we use in this country, meaning that we only import about 30%. And to be clear, no country in the world actually produces 100% of the medical products that they need or that they use. Most countries actually have some small share of imports of these products. What is not acceptable to us in Nigeria is the fact that the bulk of the demand is actually imported. This is not good for national security. It's not good for preparation for uncertainties. And we saw what COVID did when it hit in 2020. Now, the market we added, the second KPI, before I forget, is reducing outbound medical tourism. In this country, we spend about $1 to $2 billion every year on outbound medical tourism, people going out abroad. So we intend to address this by establishing the strong infrastructure for hospitals, for diagnostic facilities, bringing about the necessary human capital, the expertise that we need to be able to address many of the things that we go out to other countries for. The third KPI, the final one, is increasing mobilizing local resources for investments locally, but also foreign direct investment, but also creating jobs along the various parts of the value chain. So how do we do this? We do this 2 ways. We address the policy issues, and when we talk to the industry, and we've been engaging with the industry, pharmaceutical manufacturers, vaccine manufacturers, medical consumable manufacturers, we have created platforms where we have been addressing this. Most of the key issues are around policy issues, regulatory issues. So regulation, again, is really critical. And that's why I think this dialogue is really, really important. The second one we address is really just working with the private sector, identifying the manufacturers, so this is purely, truly a PPP, bringing the public, making sure we unlock all the policy and the regulatory and legal challenges that they face, but also working with the private sector to be able to bring about improvement. Now, what have we been able to do so far since establishment? We've hit the ground running. We started in January of this year, but on the policy side, as you might be aware, the President, His Excellency Bola Ahmed Tinubu, has signed an executive order that I think about a month ago that really address many of these issues. So some of the components of that executive order include, zero VAT, zero duty for machinery and raw materials for the production of APIs, for the production of RDTs, rapid diagnostic tests, for the production of bed nets, and many of these medical products that we consume heavily in this country. There's also a provision for market shaping activities in that executive order, that calls for volume guarantees, pool procurement mechanisms, so that, at least you can provide incentive for manufacturers. Right now, we've just finalized the development of the framework for implementation of this executive order. We will be sending it to the Attorney General any moment from now, that he will now sign and gazette, and then it becomes effective immediately. This is huge for the industry, and I think that it will create really the incentive that industry players need to be able to do that. In terms of financing, we have mobilized, we'll be mobilizing funding. We have signed a $1 billion facility with Afrexim Bank to support the healthcare sector. This is a pool of funds. We having similar discussions with the Africa Development Bank, with the European Investment Bank. So our guarantee or our commitment to Nigerians is, if you have a good business, a feasible business that is viable, that has feasibility studies, the money should not be a problem. You should worry about something else. But really, what we're trying to do is just to mobilize these funds that will address various components, whether you're an SME, whether you're a big player, whether you want debt or equity or guarantees, whatever, various instruments that we are shaping and creating along with the DFIs to be able to address this. We are mobilized, we have interest from over 20 countries, so we have a solid pipeline of projects in the various sectors. And by the way, we've developed very solid business cases for pharmaceuticals, for therapeutics, for vaccines, for rapid diagnostic tests. This is detailed analytical work that we've done. So we understand the entire space. We know who is playing. We know what the volumes are. We know what the CapEx requirements are. So we have that, and we'll be happy to share this information. We've signed a number of MOUs with key partners. On R&D side, we've done an MOU with a company called Universals in Brussels that will create an R&D platform for mRNA vaccine facilities. 2 weeks ago, we signed an MOU with USP, United States Pharmacopoeia, and part of the provisions for that MOU is actually to strengthen some of our regulators, to give them the right training, but also the right capacity building that they can be able to regulate better. Now, let me conclude by addressing heads on the issue of regulation. And I want to state, when we talk about local production in Nigeria, and I say this everywhere, local production should not and does not mean low quality products. Local production means local production, means high quality, the highest that you can find anywhere, because our citizens, Nigerians, deserve to have the highest level of quality of products as they can get anywhere else. So to be clear, this is very important to state. Because of that, that means regulation is key. The products, the human capital, the premises, the services that are being provided will have to be effectively regulated to be able to attract investments. No investor will come in and invest in a place where regulation is weak. If you want investors to come, they want to be able to come to know that when they come, there is effective regulation, so that players or producers of fake products or substandard products and services will not be allowed into the market to undercut their own businesses. So that is very important. But it's also important to note that no investor will also come into a place where regulation is also opaque, is ineffective, and insufficient, and is actually blocking and becoming a bottleneck for investment and for efficient running of businesses. So there has to be a balance. So when we call for regulation, we're calling for a transparent, efficient regulation that is in tune with the times, that is in tune with the current technological advancements. But because we are also not working in silos, we're also calling for harmonized regulation, because Nigeria, as big a market as we are working again within other ecosystems. So the West Africa market, 550 million people, you have ECOWAS, when you cross the continent to the rest of the continent, you have the Africa Continental Free Trade Area, 1.3 billion people. We are establishing the African Medicines Agency. So there is a need to harmonize all these regulations that we provide in these countries, so that we actually in tune, because this will actually create competitive advantage for our own manufacturers. I will end by calling, I'm part of the current government, but to say that I absolutely agree that our regulatory agencies should be strengthened, should be supported, should be strengthened. in terms of personnel, in terms of funding, in terms of technological tools, in terms of training, in terms of capacity building. And I must say that this is one of the key things that the current administration, the Minister of Health, Professor Pate, and the entire health ecosystem has actually understands and is trying to bring to fruition. I'm glad that our regulators currently existing have great leaders. In NAFDAC, we have DG Professor Moji, who is of course world class and is well recognized in what she's doing and trying to bring about a lot of reforms that will make regulation, like I said, more efficient, more nimble, but also supportive and friendly to the private sector. So this is really important. So I will conclude again by saying this is a timely conversation as we try to unlock the healthcare value chain in Nigeria and to bring about all these reforms. I think it's critical that we examine the role that our regulatory agencies are playing, that they need to play, and to be able to help them in as much way as we can, because this is actually central to the entire healthcare agenda and the entire unlocking the healthcare value chain agenda. Thank you very much.
Thank you so much, Dr. Mukhtar. Thank you for that elaborate keynote address, and the fact that you have also given us the context of what your initiative, what the Unlocking Value Chain initiative is all about. Thank you for doing that. It's good for our members in the public, in the healthcare industry to know what is going on in your unit of the government. Now, our goal is to see how to achieve having smart and agile healthcare regulatory environment. To give us the context setting, why we're here today is Dr. Obinna Newihe is the interim head of the New Ventures, responsible for creating and launching spin-out companies from Nesta's Mission Studio. He's a medical doctor with expertise in health systems, financing, and policy. Dr. Obinna is, an institute healthcare policy practitioner who has also worked in various places, including the Oxford University, where he was responsible for early life science ventures to develop their products, raise capital, and scale. He worked as a senior venture manager and stream leader for health at the Creative Destructive Lab. At some point, he was also the technical lead for health at the Commonwealth Secretariat in London, supporting policy development and implementation across health and social policy. Today, also, Dr. Obinna currently serves as the co-thematic lead of the Health as Business Thematic Group of the NESG Health Policy Commission. So Dr. Obinna, you're welcome. Please, over to you. Give us some context why we are here today. Over, thank you.
Thank you very much, Dr. Benson. Welcome everyone, and thanks for the keynote, Dr. Mukhtar. I'll just go right into it. If we have the next slide, please. Okay, so regulation is usually not the most interesting thing to talk about in healthcare, but it's critical. And just looking at it from first principles today, at the heart of medicine is where we talk about first, do no harm is a critical part of our work, as medical practitioners and people in the healthcare industry. What that tells us is that safety is at the heart of what we do. And if we look at that word, safety in itself, it means being protected from risk or danger. I think that word, when we look at it being protected, it confers a lot of responsibility on us as stakeholders in the healthcare industry. I just want to bring this up that we have responsibility for 200 million plus people that need healthcare in Nigeria and require this healthcare to be safe. Safety, again, features are central to what we do in healthcare. Regulation boring as it often seems, is critical for setting, enforcing, and monitoring safety standards. Safety, we know, is threatened by any kind of weak regulatory environment. And so one of the things that we see going forward is that we are still in a fortunate position in Nigeria where the seal or approval from our regulatory agencies still come with a lot of confidence. For instance, people still ask for NAFDAC numbers when they're purchasing drugs or and things. And so that's actually a good place to be, because in the reverse of that, or the flip side of that, is where people don't even trust the regulators to be able to protect their health, or what the regulators have approved to be safe. The public doesn't trust it. And so bearing this in mind, that the public still gives us that confidence and still want to see regulatory approval on products, we don't take that trust lightly. Despite this huge role for regulators to perform, they still faced with a lot of challenges. And it might sound like preaching to the choir, but we are very well aware of this. I will just reiterate some of them. We have resource constraints, both financial and human constraints, to be able to carry out effective, regulatory activities. Also, we've seen that we have the limited enforcement capabilities when it comes to regulation. We're going to go a bit more into this in the panel, and we also have issues with competing agencies. Do we go to SAN? Do we go to SON? Do we go to NAFDAC? Is it the responsibility of the FCPC? There are multiple agencies, and sometimes, while as experts we might be able to understand what each body does, it's not often is not very clear to the general population. Also, we have outdated and often conflicting legal frameworks that we work through when we're looking at regulatory agencies. Next slide, please. So what? So why is this important? Why are we looking at regulation today at the NESG? We see that with deficiency in regulatory enforcement, there are very, very far-reaching consequences for this. Some of the areas where we see a lot of these deficiencies playing out and what it leads to, we begin to see a massive proliferation of unlicensed healthcare practitioners and facilities, especially in the rural areas. And I like some of what Dr. Mukhtar said around the fact that because we're delivering these things to Nigerians doesn't mean it has to be lower quality. And oftentimes we see that facilities which are in the cities or in city centers have often have the required regulations. But facilities on the outskirts of town and in other rural centers often skirt on the side of regulation and don't always have them. No life is more important than the other, and we're thinking very strongly around how do we make sure that every Nigerian has access to quality healthcare that is safe and efficient. We also see a lot of this failure regulation around, the provision of fake and substandard medication, and also on safe medical products. And so it's very refreshing to hear that a lot of global quality standards are being put into the facilities that are being developed in Nigeria to make medical products and drugs as well. What does it mean when we begin to have a failure in regulation? What does that look like for the industry and for overall healthcare? While we have very good amount of public trust in our regulatory agencies, a failure of regulation could very severely undermine public trust, and that has severe consequences, as there's no way to guarantee the authenticity of product, especially healthcare products, and that's not where we want to get to. Ultimately as well, we see a discouragement of long-term investment in the sector where there's no regulatory framework and where there's no trust in the legal system as well, where we are continuing to lose money in medical tourism, and some of this is linked to the regulation. And then finally, overall, at the end of the day, we're seeing worsening health outcomes despite rising costs of delivering healthcare, and we're also seeing poor quality. And so we seem to be spending much more naira in hard terms, but the population outcomes we're seeing don't appear to match the amount of investment and spending that we're doing just because the healthcare being delivered is not safe and it's not efficient. Final slide, please. Next slide. Okay, so these are pre-summits. Where do we go from here? The NSG convenes the National Economic Summit every year. We're having that in October as well. And this is a build-up to the summit as we have discussed already. What do we need to do? Where do we go from here? All these are questions that we're asking ourselves, and we're passionate about these issues. Hence, we've left what we're doing to join today. We urgently need coordinated efforts, and I'm so happy to see the panel that we've convened today because it needs to be, coordinated across multiple regulatory bodies. We also need to invest in capacity to implement standard and also review overlapping responsibilities, just like we often see in tax paying as well, where people complain about multiple taxation. We have similar sentiments when it comes to healthcare regulatory bodies as well, both on the individual level and at facility level and even manufacturing level as well. There's need to harmonize our regulatory frameworks to give confidence for investment as well. And then finally, we continue to develop an environment that prioritizes the sustained development of the healthcare sector. We're not assuming that we get there in one day, but what we understand is that by putting the right regulatory framework in place, we know that this is a journey towards improving healthcare for every Nigerian, and we're on this journey together, strengthened by regulation. In conclusion, we ask ourselves, we've gone to so many conferences, so many summits. We're quite experienced professionals. And every time, there's a lot of enthusiasm, usually with conferences, and we leave and we say, so what, who cares, what next? So that's the question I want us to ask ourselves when we're leaving this event. We are mostly leaders in the healthcare industry here, and we have, a certain amount of control and influence in our industries. And so we need to ask ourselves, if we don't begin to take action, if not now, when exactly are we going to get this to work? There's only this country we have, and so we're committed to making it work. And so we're committed, to drive safety, remembering what we said, the ability to receive care, or the understanding that, when people purchase health products or walk into a health facility, they have that understanding that they're going to receive care that is safe. And that's the commitment we're making to customers and to patients and to clients when they partner with us. I would like to encourage us today to have very open and frank conversations. This is not the first conference you attend on this topic, neither will it be the last, but we want to make sure that we take out very tangible items from this event today. So I very much implore you and encourage you to come with that spirit of dialogue and to have those frank conversations. And finally, there's need for multidisciplinary action. And the healthcare ministry, while it seems to be vertical, healthcare, it touches every policy. There's health in all policies. And so we realize and we understand that delivering on very effective regulatory framework will not just be the responsibility of the healthcare industry or healthcare practitioners. And we need to stretch our hands across the table to work with our colleagues in legal, finance, in the stock markets, in law enforcement, to be able to, to structure something that works for everyone. Final thing I would say really is that our lives and the lives of our families and friends and people we care about depends on our action or inaction. As leaders in healthcare, we have the responsibility today to decide what it will be. We can listen to all of what we want to say here and walk away, but we can listen to it and actually take action. It's really up to us. Thank you very much, and we expect to get very frank, honest conversations today. Thank you so much for your time. Back to you, Dr. Morris. Dr. Cole, please.
All right, thank you, Dr. Obin. A very good context setting that you have outlined there. We're going into the panel session almost immediately. But before we do that, I'm also going to take out a few minutes to introduce our panelists. We have about 6 panelists today. You left us with a question. So after now, what next? after the conversation, what next? You know, that was your parting comment, Dr. Obinna, and it's so pertinent that we look at this subject matter with a view to actually having actionable steps after an event such as this and after the summit as a whole. NASG is about setting, you know, policy directions and the likes. If today we have the Central Bank of Nigeria that coordinates, you know, and monitors and regulates the financial industry and the players in that industry at every level, why can't we have a, you know, a healthcare commission of some sort that also will be saddled with responsibility of regulating healthcare, both in the private and the public sector across Nigeria? My thinking is that if we scatter our efforts the way we are doing, trying to strengthen NAFDAC, strengthen Pharmaceutical Council, strengthen the Midwifery Council, strengthen everybody that needs strength, we may soon spread ourselves thin and still not achieve, you know, our overarching objective. So in this context, we're looking at, is it possible, as we go into the panel, these are the things we're going to be talking about, to have, you know, a centralized quality commission that will be able to galvanize the activities of, you know, all the regulatory bodies under one roof. This is actually the question we're throwing to most of the panelists today. So to address these issues, we have in the House the Director General of NAFDAC, the National Agency for Food and Drugs Administration and Control, Professor Mojisola Adeye. We know her too well, always in the news. She has, in her time, been able to refocus the agency through quality management systems approach and the WHO global benchmarking to be, you know, the standard operating process, you know, procedure that drives the organization's efforts. They have embraced such international standard and best practices at NAFDAC, you know, to move the country forward in the areas of food and drug administration and control. Professor Adeye graduated from the University of Nigeria in Nsukka with a bachelor degree in pharmacy in 1976. She obtained her PhD from the University of Georgia and in the USA and in industrial pharmacy in 1988 rather. And then prior to assuming the position of Director General of NAFDAC, she was a professor of pharmaceutical manufacturing and drugs evaluation for 30 years in the USA, a retired professor emeritus from Roosevelt University College of Pharmacy, Chicago, Illinois, USA. So thank you for joining us. Let me quickly also introduce Dr. Victor K. Benro, who is a Deputy Registrar of the Medical and Dental Council of Nigeria, the regulatory body for medical and dental professionals in Nigeria. As a Deputy Registrar, he holds a senior position within the organization and responsible for overseeing various aspects of medical and dental education and practice in the country. We also have on the panel, Dr. Modupeola Ogundimo, who is a seasoned IT health system strengthening professional. He's a director with the National Health Insurance Authority. She is currently the head for the NHIA zonal head for Lagos Zone. In the last 19 years, she's been at the helm of most of the authorities, the key departments, playing critical roles in operations, policy development, research and planning, and then towards the implementation of a formidable health insurance ecosystem in Nigeria. So Dr. Modupeola, you're welcome. And then we have also on the panel, Dr. Ajibike Oyewumi. She is a health quality specialist for the International Finance Corporation, the IFC, an arm of the World Bank. Dr. Ajibike is a quality improvement specialist, an obstetrician/gynecologist, a fellow of the West African College of Surgeons since 2001. She joined the Lagoon Hospital Groups in 2002, and later became the head of quality improvement and patient safety, leading the hospital to achieving the first joint commission, that is the JCI International Accreditation in Sub-Saharan Africa in 2011. Dr. Yeomi worked also as a quality improvement advisor in Canada before returning to Lagoon Hospitals in 2017 thereabout, where she contributed to their second round of accreditation in 2018. So a board member of the Society for Quality in Healthcare in Nigeria since 2007. Dr. Yeomi helped develop the quality standards for hospitals accredited by the International Society for Quality. You're most welcome, Dr. Yeomi. We are glad to have you. And we also then have Dr. Abiola Idowu, the Executive Secretary, Health Facilities Monitoring and Accreditation Agency, HEFAMA, Lagos. Dr. Abiola Idowu holds an MBBS degree from the Obafemi Awolowo University, Ile-Ife, and she began her her medical career as a general practitioner, then went on to have a master's in public health from the Lagos University Teaching Hospital. She has served as the State Health Management Information Officer from, when she joined the Lagos State Health Ministry in 2003. And then she headed the Research and Statistics Department. She also has played key roles in transitioning the health information system of Lagos State from paper to electronic formats, earning her recognition from the National Council on Health. She's also a recipient of the 2007 Best Performing Senior Officer Award in the Ministry of Health, Lagos State. You're welcome, Dr. Abiola Idowu. Thank you for joining the panel. And lastly, today we have Dr. Amil El Tawani. Dr. Amil El Tawani is the Chief Executive Director. You might want to call him the Chief Executive Officer of the Egypt Healthcare Authority, a position he has held from the inception of that agency from 2019. He's also a steering committee member of the Egyptian Universal Health Insurance System and serves on the Supreme Committee for Medical Distress. In addition to these roles, Dr. El Tawani is a member of the Arab Hospital Federation Executive Council. Dr. El Tawani has been recognized with the Egypt Award for Government Excellence as the best sector head in the Individual Excellence category. He holds a master's degree in clinical operations from Harvard University, an Egyptian fellowship in health facilities management, and a master's degree in diagnostic radiology. So thank you everyone who's on the panel this afternoon for joining us. I'm going to go straight away into the question session on the panel. And I'm going to start in no particular order, but I like to start with the IFC, I think, because as they say, money matters a lot. So because we're talking about strengthening the healthcare regulatory agencies in Nigeria, and part of the things we have identified is the poor resource support that they have, and that is why some of the agencies cannot perform optimally. So starting with the IFC, considering that funding gaps contributes to the weak regulatory environment in healthcare in Nigeria, how can the IFC assist Nigeria in this regard with the funding support to strengthen regulatory bodies in Nigeria? A follow-up question would be, will it be easier for the IFC to support Nigeria if all aspects of healthcare regulation was coordinated by one central body? Like I mentioned earlier, like we have the central bank regulating the financial industry. If we had a one central body regulating healthcare in Nigeria, would it be easier for the IFC to support such an agency? So that will be our takeoff question. So please, you may go ahead and give us your insight into this line of questions. Thank you. Over.
Thank you very much, Dr. Benson. Thank you to the NESG for inviting me, inviting me on behalf of the IFC and World Bank. And please allow me to stand on existing protocols. First of all, let me restate the commitment of the World Bank and the IFC to strengthening, to the provision of access, to supporting the provision of access to care, but not just access to care, because it's not just about care. Otherwise, we won't be here, right? It's about high quality care, the best possible quality care. And the organization has even very recently restated its commitment, sometime in April, to supporting the provision of care to at least 1.5 billion people by the year 2030. Now, this is going to be done through a combination of ways. One, of course, is financing. Secondly, is the knowledge. And then, providing partnerships to support organizations. I think it's important to state some fundamentals, about regulatory frameworks before I go on. And this is because, what regulatory frameworks is about is getting healthcare to the people. We're not talking about frameworks just for the purpose of talking about frameworks. So it's about making sure that there's access to care and the supporting mechanisms or supplies or whatever it is, and the quality of that care. And that has been talked about. So first, one of the fundamental things that we have to talk about is prioritizing public funding. We have to think about prioritizing public funding before we go into what the World Bank can do. We have heard, it's said today that Nigeria currently has one of the lowest levels of public funding for healthcare. In fact, when I checked, we're at about number 172 on the ranking out of 192 countries. It's very, very low. And we have signed on to universal health coverage. It's a principle that we've signed on to for very many years. So the government has to prioritize public spending. It has begun that journey. As you know, we've been talking about universal health. We've been talking about national health insurance. Without national health insurance, we're not going to go very far. We're not going to go very far. Now, what national health insurance does is that it provides the pot of funding for healthcare. And because government cannot do it alone, it will then begin to reach out to the private sector to purchase healthcare. And hopefully, all this together will provide the access. But then you have to think about the quality, what is it that people are getting? Public financing is necessary, like I said, but it is not enough. There have to be other reforms that would come, and these would also come in terms of regulation. Again, we're getting there. We've heard about the National Health Insurance Act, which I must say, IFC was very fundamental in supporting that act passed through into law. We played a very strong role in doing that. And again, it was funding that was provided to be able to do all that. Okay, but we need to deepen the strategic purchasing of healthcare. It is very important that we think about this. We are able to define the minimum packages. We're able to define what standards look like. We're able to define what the criteria should be for empaneling hospitals, whether they're public or private. The fact that it's public or private doesn't make you doesn't make you exempt for providing the right standards of care, right? But we have to think about how that is done, the reimbursement of providers for that. And that is one place where definitely IFC can support. So Dr. El Tawani will be talking about his experience, and hopefully he would mention his experience with the World Bank IFC. That is one project that's still ongoing, where we've been working very strongly supporting GAHAR, which is the body that the national body for health insurance in Egypt. IFC has provided funding to make sure that they're able to develop their standards, develop the people, train the people, and then provide these standards. Part of the work that I have been doing as well, where we are able to support the deployment of these standards and work with hospitals to bring them up to the level where they're able to provide better standards. So talking about this, what can the World Bank do? Because that's what you want to hear from me. What can the World Bank IFC do? Well, one of the things we're doing at the moment is supporting the expansion of priority of health services. You know about the 500 million Naira Hope Health project that's ongoing. That pot of funding hopefully would, some of it will go towards strengthening regulatory agencies, right? Because it's a pot of funding. I'm not sure we've defined exactly what you will spend per dollar, but part of that money should actually go into that. But the other thing that we do, which is not directly giving money, but is important because it also has to be funded, is a provision of technical support, technical advice for institutional reforms. Okay, we support the enactment of laws, provide technical advice to bodies. And so we can provide technical advice to the regulatory bodies that need to be strengthened. That much we can do, even in terms of public-private partnerships. Now, the other area that we've been working a lot and we are able to do more is in supporting quality initiatives, quality improvement reforms. Like I said, with GAHAR in Egypt, where the National Health Insurance is working, is they have GAHAR, which is the equivalent of our own HEFAMA, but at a national level, right? And we've supported the organization to develop the standards and ensure that hospitals that are going to be providing care meet a minimum requirement level. Several of my colleagues are out there, they've been working, especially with the private sector, because IFC works largely with the private sector. World Bank does largely public sector. But they've been working and providing support to these hospitals to meet the standards such that they can be registered to provide universal health coverage. So that's very important. We've developed all kinds of tools that can be deployed, right? For quality standards tools, digital health tools, pharma solutions tools, greening, which is part of what we need to be looking at, right? And energy efficiency resource tools, ethical principles, resource tools, right? All those are available to be deployed to strengthen regulatory agencies. Of course, if you're going to, even if you're supporting regulatory agencies and the hospitals cannot deliver the care, what happens, right? So IFC works with private healthcare providers and can provide funding that would help them meet the standards too. Of course, you need money to be able to meet some of these quality standards. You need money to improve your facilities, to get the right people in place, to get the right tools, and all that, provide training for your staff, right? So IFC invests in healthcare providers, private healthcare providers, so that they can come up to the level where they're able to deliver the kind of quality care that Nigerians deserve. And of course, we do provide quite a bit of support for private-public, public-private partnerships. We provide a lot of advisory to strengthen them. So I guess I'm not saying that we can put in $2 or whatever tomorrow, but there's a lot that can be done. There's financing, but there's also the technical advisory, which is really, really needed, right? To be able to deliver, to strengthen the regulatory bodies, to be able to do what they need to do. So thank you. The second question, sorry. Second question was about whether we think that one central body will do it. I I don't think we've discussed that as an organization, so I can't speak for the World Bank IFC, but I know for sure that it's not as easy as it sounds, right? Bringing all organizations under one umbrella. And is it really necessary? I think we would have to think about it again, right? In preparing for this, I went to look at, various countries that we all look to and seem to be doing well. Interestingly, I don't see any nation that has every single thing under one body, I must tell you. And I'm still looking, because maybe it would help, like you said, especially so that we don't disperse energies. I think I would say to us that we don't get distracted with this notion of everything must be under one body, because there's so much, right? There's pharma, there's healthcare providers, there's the professional bodies, it's huge. Are we going to be able to do everything under one body? It's something we would have to think of very carefully before we start pushing that notion, right? But maybe there's some that can be brought together, professional bodies, hospitals, or healthcare delivery facilities. For instance, we can look at, should those be done like that? But for me, I think it would take a bit more consideration. I haven't seen any examples where everything has been brought under one body. I have seen Gahar, which I think Dr. El-Tawani is going to be telling us. Yes, they do look at regulating healthcare delivery facilities under one body. But if we're talking about everything else, I am not sure. So that's my submission. Like I said, I'm not speaking on behalf of the World Bank with regards to this. Thank you.
Thank you so much for your insight and your perspective on this. We are also happy to hear that the IFC will be in a position to offer technical support, will offer funding at a certain level. That is great to hear. Thank you so much, Dr. Ajibike Oyeomi. Thank you. Now, I'm going to go to Dr. Gwenro, the Deputy Registrar at the Medical and Dental Council of Nigeria. Again, on the same subject matter, if we today have a central body coordinating the issues around healthcare regulation and quality in Nigeria, where we have all the various regulatory agencies represented in that, under one roof, would you think that the Medical and Dental Council will function better under such environment? Or what would be your perspective in terms of strengthening the Medical and Dental Council regulation in Nigeria? Because if you look at it today, I think Dr. Obinna also mentioned, when you are in the metropolis practicing medicine in Nigeria, in any of the major cities, yes, you will feel the impact of regulation one way or another. But once you leave the metropolis to some of the semi-urban and rural communities, regulation is completely lost. So whether it is regulation of doctors, regulation of nurses, regulation of laboratory scientists and the likes, you don't have as much regulation in the hinterland as you have in the metropolis. Please, can you speak to this and let's hear your perspective? Thank you. You're welcome, Dr. Gwenro.
Yeah. Thank you, Dr. Ayodele. I want to start by appreciating the convener of this summit webinar. I also want to appreciate all the previous speakers, Dr. Ebanji, Dr. Mukhtar, Dr. Obinna. Thank you so much for the insight into the discourse for this pre-summit session. So, strengthening healthcare regulation bodies in Nigeria, it is one of concern, really, I would say. And with that, I bring you greetings as well from my registrar, Dr. Fatima beneficiary, who also would have been here, but she has told me to be here to be part of this important discourse. So whether or not we should have a quality commission where we are going to house all the regulatory bodies in the healthcare sector, it's one that, I know many have been talking about. But we have to look at where we are as a country. We are a federating unit. We have a constitution. Healthcare is not in the exclusive list. Healthcare is not, it's in the residual list. So that is the states, the various actors, the state government, the federal government, the private sector, have a lot, to play around this. So it's quite a difficult one. It's quite a difficult one. It is challenging in the healthcare sector. There's underfunding, as has been said by the last speaker. There's gross underfunding of the healthcare sector in the country. There is a challenge of lack of cooperation or collaboration between key stakeholders in the public, private sectors. The healthcare cannot do it alone. We need to work with the judiciary. We need to work with law enforcement agencies. So it's quite difficult, and this has caused a lot of challenge in citizens getting the right form of care. At the Medical and Dental Council of Nigeria, we are saddled the responsibility of regulating the medical, dental, and alternative medicine practitioners. But we do have instances where there is encroachment on practices of various practitioners. Now, and this is because there's lack of cooperation or collaboration between the 14 health professional regulatory bodies in the country. You'll find a situation where a medical lab wants to go and regulate the facility of a medical or a dental practitioner. These professions or professionals are distinct, and it has been difficult over the years for them to work together. We have in South Africa, where we have the Health Professional Council, where all the healthcare professionals are housed, and they achieve good results with that. It's something that Nigeria can learn from. But like was said by the last speaker, lots of other countries have their professionals regulated individually, and they don't seem to have much problems like we do have in Nigeria. So I would think that our major issue has to do with our laws and policies. Many are conflicting, especially in the health professional councils or boards. It is conflicting. There are encroachments. As you well know, the Medical and Dental Council of Nigeria, or like other health professional bodies, regulate their professionals. They do not have direct regulation on the facilities where their professionals are practiced. And this makes regulation very ineffective for these professional bodies. And so we are concerned as a council that the environment where our practitioners that we license to practice, go to practice, are not directly under our control. And then when we try to collaborate with many of the stakeholders, we meet brick walls, there are bottlenecks, there are pain points. So this has been has brought in a lot of frustration. We operate as a council where we have 61 members in our council, and largely 36 of them plus the FCT, that the Director of Medical Services, are members of the council. But unfortunately, they lack the power or the capacity in their various states to implement some of these decisions and policies of the council at the state level. And this is where the challenge as a council comes. And that's why we have lots of quackeries going all around. And that's why we have a lot of our members in unethical practices. So this is a challenge. So the big question of whether we should have all regulatory bodies under one roof is something we need to sit. And as a council, as the Medical and Dental Council of Nigeria, we have not critically looked into that. And we feel that our supervising ministry, the Federal Ministry of Health, needs to take a bold step on this, because the professional regulatory bodies are under the Federal Ministry of Health. So it's something that we need to sit down as a country, and it's good that this is happening at this time where the renewed hope agenda, has come. So I think we need to sit down and really discuss as a country. We need to look at our enabling laws, our policies. Do they favor this or not? And where we have policies or laws that are conflicting, we try to streamline things. Because presently, many of these agencies work in silos, and it's not healthy for our country, it's not healthy for our citizens. As the Medical and Dental Council of Nigeria, we strive to provide effective regulation that will safeguard the health of the citizens of Nigeria. And we hoped and we want to be the foremost health regulatory body in the country. Thank you very much. And I hope that I've been able to answer your question. It's not a question that I will sit here to say yes or no, but we need to look at areas that we can streamline, areas that we can bring together, especially like the professional regulatory bodies. Yes, it's something that is doable. We can bring all the 14 health regulatory bodies under one roof, and we have under one umbrella, and we have, someone sitting at the helm of affairs that we direct. Because the way it is now, every professional regulatory body wants to operate on its own. There is that lack of cooperation, and that has seriously affected the healthcare delivery of our citizens. Thank you very much.
Thank you so much, Dr. Gbenro. I hope I am audible. Can anyone hear me?
I can hear you.
Thank you. Thank you, Dr. Gbenro. Very insightful. And again, buttresses some of the points we've been trying to make, all right, which is the fact that, the regulation is fragmented, multifaceted, working against each other in some cases, working in silos. I hear what you talked about, bottlenecks here and there, and the fact also that the regulatory bodies, the whole idea of regulation is not on the exclusive list, but it's on the recurrent list. I remember not long ago, I think a couple of 1-2 years ago, that the electricity generation was then taken out of the exclusive list so that states can begin to generate electricity if they wish to and deliver to the national grid. So in the same way, if we find value, this is my thinking, and this is our thinking, at the NASD, thinking that we should be able to recommend to government a policy direction that would help our, regulatory bodies to be more focused, to be more coordinated, to be more streamlined. And that's why we are toying with this idea of a National Health Commission, Quality Commission, where everybody in that regulatory environment will be, under one roof so that coordination and coherence can be better achieved. So thank you for your insight. The conversation is still ongoing. I'm going to jump quickly to Professor Mojisola Adeye, the DG of NAFDAC, because again, in this whole environment, we hear about fake and adulterated drugs coming into the market. I think there is a study, is it by the World Health Organization or so, that says 1 in 10 drugs in this part of the world is either adulterated or fake, you know. So how would you rate the success of NAFDAC in protecting the country against the influx of fake drugs into our healthcare marketplace? That's the first question. And the second question is, would you also think that this setting up of a National Health Policy Commission with a mandate to coordinate all aspects of healthcare regulation and quality, would it help to focus the work that NAFDAC is currently doing? So thank you, Professor Mojisola Adeye, for joining. Please, over.
Thank you very much for having me here. Thank you for this wonderful conversation, and I recognize the past speakers. And one thing that was running through some of the deliveries that have been made is quality. You cannot buy quality. You cannot rent quality. You have to breathe quality. To have a strong regulatory system, you have to have quality. NAFDAC started under my watch, almost without anything. In the regulatory world, supervised by or overseen by WHO, there's what is called level 1, level 2, level 3, level 4, based on maturity. NAFDAC was at -1 in 2017. And we needed to have 267 sub-indicators to get to maturity level 3, with 868 recommendations. Dr. Obina said, it's either we have action or inaction. It's either we have quality or no quality. It's either we stem corruption, self-interest, or we don't. For 60 years, we're still going round and round and round and round. So, from my previous life, I got wiser in terms of how to make an organization work using quality system, thinking quality. Nigeria has been decimated for 60 years. We were no longer what we used to be. Therefore, we have to start from thinking quality. We can talk from now till eternity. We're not going to get there until we change our mindset. We are no longer who we used to be. Corruption has eaten us to the bone. Let's talk of national health quality. Who is going to oversee it? Will that person be thinking of himself or herself? Where is the judiciary? Where is the law enforcement? We have a broken house as a country, and it is broken from the foundation. Therefore, in NAFDAC, we started quality management system in 2018, where you think of the quality of the customer first, not you, not your relative, not your classmate in the university, customer first, where we became more transparent. If you are transparent, corruption will be mitigated. We were trained for about 18 months to get accreditation. All MDAs must be trained. All of us must have our heads corrected from church to mosque, to National Assembly, to the villa. We must change our mindset. We started doing that in NAFDAC. At the same time, we started comparing ourselves with the best, not even better, in the world. In Nigeria, we compare ourselves with ourselves. What did it lead us to? Maturity level 3. From -1, we overcame 868 recommendations. We overcame 267 sub-indicators. One sub-indicator may be half a booklet, or a booklet rather. Why? Because we have to have passion for what we are doing. We have lost it. We have lost it. All MDAs must go through quality management system, all of us. I happen to be fortunate to go through it in my sojourn in the US for 30 years as a professor. I happen to know, to be trained too. So in terms of fake and adulterated drugs, in Yoruba land, they said somebody is carrying a load and your skin is very tilted. Oh, yeah, you can look at the legs of the person carrying the load. The person is lame. NAFDAC was removed from the pots for 7 years, 2011 to 2018, May 16. And we became a haven for for counterfeiters. We became haven. Why? A cabal came together to convince somebody that NAFDAC is not needed. My first year in NAFDAC, tramadol was being rained on Nigeria. And I asked one of my directors, is somebody trying to wipe us off? To make us all mad? Tramadol was being rained on us because Nigeria was taken as a haven for bad medicines, counterfeited medicines, narcotics. We are mitigating it. We have a multifaceted approach to mitigating substandard falsified medicines. From pre-shipment, medicines come before we were addicted also. Unless it comes from overseas, it's not good. We were addicted to importation. 70% of our medicines were coming from India and China. Well, that cannot be changed overnight. So before my time, there was something in place called pre-shipment testing, but it has holes. I started plugging the holes. So before a product that we've already approved comes into the country, we test it from the source. And we found one mind-boggling results. No content, little content, wrong medicine in it. After we have approved them for the right medicine, that is one method that we're using, pre-shipment testing. We have stopped over 140 of such approved products from coming into the country. Technology, we're using track and trace. We started that during the pandemic to know where all the vaccines went. NAFDAC is the leading country in Africa. We are the second leading in the world. We are using GS1 technology now to do non-COVID-19 vaccines. We're using it to track anti-malaria, antiretroviral, anti-tuberculosis, ATM products. Why are we doing this? Because we can, as a country. We can if we decide to. God has given us that endowment. We're not different from advanced world. We do the best when we're in the diaspora. Why do we come here? Why are we not performing here? Because we are burying our talents. Because we're not passionate. From the church, you will see all sorts of nonsense going on to mosque from the home. So we're using technology. For 25 years, NAFDAC did not have good distribution practice guidelines. We started having it around 2019. But COVID didn't allow us to go out. So we started visiting distribution sites. 2021, we have visited about 940 distribution sites now, making sure that the storage is fine. Think of oxytocin. It's used for induction of labor. Think of millions of women and children that have died because of bad oxytocin. I could have been one of the statistics in UCH. I was in labor for 27 hours, no progress. And when they gave me oxytocin, it didn't work. So they have to give me double. They ripped off my hospital gown with scissors, rushed me to the theater for emergency surgery. That is part of what these current ministers of health are trying to do, to reduce pain, to reduce death. If it is pain, you can manage it. To reduce death, I could have died. So this is part of what we are trying to do, good distribution practice. We are plagued with open markets. I asked one of the manufacturers, says, when did we go mad in Nigeria? I left Nigeria in 1980 as a pharmacist. I came back, I met a different country. When did we go mad? Open markets, where you can sell anything. We started focusing on open markets. Kano. We have 4 large open markets: Kano, Lagos, Onitsha, and Aba. They resisted us meaning NAFDAC and Pharmacy Council of Nigeria. They attacked us. There was a riot. They didn't want to go. The lawyer for Pharmacy Council of Nigeria was mobbed at the premise, the court premise. His car damaged, and he had to run back into a court that is still in session. And what are we now finding in the open market? Things that they brought from open market, from the open market to coordinated wholesale center, CWC, that was built in Kano. We forced them to relocate so that we can monitor them there. What did we find? The baggage that they brought, they brought from open market to coordinated wholesale center. Pediatric medicines without any drug in it. It's in court now. I insisted they should be taken to court. They were in jail for about 2 months with 0 medicine. Amoxicillin, cloxacillin, 0. Erythromycin, 0. Antemetal lumefantrine, 0%. You don't need to put a gun on a child before you kill the child. Just give a child with upper respiratory infection medicine without drug without medicine in it, or whatever I want to call it. So-called medicine without anything in it. That's what we are doing now. We are forcing them. Open markets. We use many technologies. I'm just giving examples. If not, we will not be where we are. We are being compared to the best. That is benchmarking yourself with the best. Maturity level 3. We are going to maturity level 4. We are now also going to world listed authority, where any product that is manufactured in Nigeria can be traded globally. Dr. Abdul mentioned that the fact that we are talking about local manufacturing doesn't mean we are making poor medicine. We will not allow that. That is part and parcel of why we are maturity level 3 and why we will be maturity level 4, because we are watching our manufacturers like a hawk. I want to go to the next one, that's whether we should all come together. I would say a big no. We cannot. When I got to NAFDAC, we had 13 directorates. One of them is the laboratory directorate. In the laboratory directorate, they had about 457 staff. The head of that directorate was in Lagos. How can you manage 457? It depends on the type of healthcare unit that we are talking about. For regulation of drugs, no, it can never happen. So I said, we have to have a manageable unit. So we started breaking down the laboratory. We now have 4 directorates so that effective overseeing of quality of medicine that is being tested can be done. NAFDAC is on the exclusive list. We cannot be concurrent. So it's okay if, because what Dr. Benson is saying that, maybe everybody can be made exclusive. It may work for maybe for the medical doctors and so on. It will not work for regulatory agency for drugs. PCN and NAFDAC are the regulatory agencies. PCN oversees the practice, both the professionals and the practice settings. NAFDAC oversees, that is downstream. We oversees by the law that created us, both upstream and downstream. So we have to work together. But as it is right now, unless something happens to make PCN and NAFDAC to come together, it can happen. I don't know, but not with the other healthcare delivery. It's better to make sure that we can speak the same language, we can think the same language based on the training, based on the focus of each profession. So just to summarize, we are working night and day. Local manufacturing is access. Local manufacturing is monitoring, easy monitoring of the manufacturers compared to going overseas. What we want to do is to make sure that we are manufacturing about 70% and importing about 30%. And the 70 that we are manufacturing will be of quality. They are already turning out to be of quality. Because we hear that a manufacturer is not doing well, we shut them down. But we do routine inspection. We do focus inspection so that we can make sure that they are adhering to good manufacturing practices. So with that, I want to say thank you very much. I believe I've answered the 2 questions. Thank you. I hope everybody can hear me, that I'm not talking to myself.
Yes, we can hear you,
Yes,
ma.
we can hear you, ma.
We hear you.
Thank you. Thank you.
Dr. Benson.
Dr. Benson maybe is having transmission problem. Dr. Benson, are you there? Okay.
I'm not sure why we can't have Dr. Benson, maybe some technical hitch. Thank you so much, Prof.
Thank you.
For that very insightful and yet emotional point of view and perspective. And thank you for sharing with us all of the good work that you're doing in NAFDAC. We do very much hope that as a collective health system, the impact is felt across board, and the entire health value chain also derives a lot of value from your very valuable and impactful efforts. I'm now going to call on the next, and I'm going to a bit lean on hindsight, believing that the next panelists did receive the questions ahead. I'm going to call on Dr. Namer, who is representing Dr. Amer El-Tawani, the Chief Executive Officer of Egypt Healthcare Authority. And we particularly invited them to be part of this panel because we also wanted to learn from other parts of Africa that seem to have succeeded in being able to manage, regulatory landscape as far as health is concerned. And so I have Dr. Namer here. Dr. Namer, if you're ready, please, can you share insights around how it's been going in Egypt, and particularly concerning some of the recent works that you've done with the Egypt Healthcare Authority. We're aware that now there's a deliberate effort from the very apex government to ensure that health is prioritized, and healthcare is given a lot of front burner conversations and deliberations as far as the Egypt government is concerned. Can you share with us insights that you think that Nigeria can leverage and can lean on in advancing its own regulatory landscape going forward? Dr. Namer, over to you.
Greetings, Dr. Benson, esteemed panelists. I'm participating on behalf of Dr. Amir El-Tilwani, Egypt Healthcare Authority CEO. I'm afraid he had a pressing commitment with the ministry that required his immediate attention. I'm honored and privileged to join you today in discussing these most critical issues facing regulation of healthcare practices. As we experience rapid advancements in medicine, evolving patient needs, the regulatory landscape must evolve to balance innovation with patient safety and equity. Previously in Egypt, and let me share with you our experience in Egypt. Previously in Egypt, patients encountered numerous challenges, including dissatisfaction with the service quality and disparity in service availability. Rural and undeserved communities received inadequate health care, forcing many individuals to travel long distances to seek treatment. Consequently, the resilience or the reliance on private hospitals increased, adding to the financial burden on citizens. And I understand that Nigeria might face the same problems that Egypt's healthcare system faced before. In response to these challenges, Egypt introduced the universal health insurance system with the goal of achieving comprehensive healthcare coverage by 2030. This system emphasized quality, fairness, equity, and the most important of all, accessibility for all Egyptians. The regulatory framework of this system is designed to ensure that quality, safety, and efficacy of healthcare services are achieved through a structured approach. Expanding population and service coverage was financing this protection, complemented coverage, and social determinants of health, controlling population growth, and improving the quality of life were the most primary framework of universal health insurance system. This system rolled out health planning, social marketing, developing a qualified, motivated healthcare workforce, embracing digital transformation, integrating services delivered on family health model, enhancing safety and quality of services, strengthening health system resilience, and partnering with a well-regulated private sector. And finally, promoting Egypt as a medical tourism hub. To support this vision, Egypt Healthcare Authority introduced comprehensive service packages across all healthcare facilities, focusing on equity and improving accessibility, particularly in remote and under-deserved areas. The Egypt Healthcare Authority has adopted a high-quality, patient-centered approach. And to conclude, Egypt Healthcare Authority has become Egypt's primary healthcare service provider, symbolizing the principles of health equity and well-being under the Universal Health Insurance Act. In just 4 years, Egypt Healthcare Authority has expanded to operate over 310 healthcare facilities, and has delivered over 34 million services, including 500,000 surgeries, and has achieved a notable success with wide-scale implementation of automation and digital transformation. Quality accredited almost 80% of its facilities, amongst 2 JCI accredited hospitals for the first time in Egypt in public governmental sector that we can gain GCI or accredited hospitals. And finally, 2 green recognized, internationally recognized hospitals. This is a pioneering achievement in Egypt. Moreover, Egypt Healthcare Authority has realized a remarkable 91 satisfaction rate of patients, rising up from 76% from the last 4 years, reflecting significant progress in improving patient experience, which highlights Egypt Healthcare Authority commitment to equity, patient safety, quality, and environmentally sustainable practices. From my perspective, and drawing from Egypt's experience and other best practices and healthcare regulation, it is clear that Nigeria healthcare system would benefit from a unified approach involving all relative ministries and government agencies. This collective effort is crucial for initiating a transformative reform in the healthcare sector. And in order to achieve this transformative reform, it is important to address disparities in healthcare access and quality across different regions and populations, and to develop strategies that enhance healthcare services in rural and underdeserved areas to improve rural healthcare, with focus on ensuring health equity and justice, and providing affordable quality healthcare services to everyone, regardless of their financial capacity. And I want to summarize some of the recommendations for Nigerian healthcare reform. I believe that Nigeria healthcare reform needs to strengthen legislative framework to enhance and enforce compliance with healthcare regulations, improve licensing and accreditation, like Gahar, as you mentioned before. You need to have a licensing and a national accreditation system to invest in quality assurance, implement regular inspections, develop quality metrics, and enhance centralized oversight, and to leverage technology and data in order to adapt advanced health information systems and data analytics to improve healthcare delivery and management. Moreover, it is very crucial to engage stakeholders, involve all healthcare professionals, patients, industry stakeholders in the regulatory process and from the planning process. Is also to establish a feedback mechanism to ensure that everyone has a voice and that regulations are practical and addresses real world needs, and to promote professional development in order to mandate continuing education, support training programs for healthcare professionals and administrators to enhance their skills and knowledge, and increase public awareness and education about healthcare. Finally, it is very important and fundamental to strengthen community engagement through promoting health literacy through educational initiatives that empowers individuals to make informed health decisions. By implementing these recommendations, Nigeria can significantly strengthen the healthcare regulation, improve service quality, and better meet the needs of its population. Thank you.
All right.
Thank you so. All right. Dr. Benson, over to you, sir.
Thank you, Dr. Morris. Thank you. Again, we need to regulate the internet space as well. All right, thank you so much. And now we've been speaking about this subject matter, and one thing is always coming to the fore, the fact that there is disconnect, interagency disconnect, even intra-agency lack of alignment and the rest. When Professor Mojesola spoke, she spoke about the fact that they were nearly mobbed, or they were actually mobbed in Kano and all that. Now, when you're in the heart of Kano City regulating and you're facing challenges, what do we then do by the time you leave Kano City and go to the local government areas that are quite diverse? I think it will help also with some solutions that will make regulation a bit more widespread across our diverse geography. So thank you everyone for your insights. And I thank the representative of the CEO, the representative of Dr. Amir, who was not able to join us because he's in another important meeting in Cairo at the moment. So we had Dr. That's Namin Ashar, technical office member to the CEO, who just spoke last before I came up. Now, I'm going to be asking two individuals who have not spoken, and then we'll be rounding up the panel before the question and answer. Dr. Modupeola Ogundemu of the National Health Insurance Authority. Just straight away, your organization, of course, obviously favors quality and healthcare access to all Nigerians.
All right. So maybe I'll just ask the question quickly as I understand it. So for the NHIA, could you speak a little bit more about this proposition for a centralized entity or regulatory body in terms of ensuring good quality healthcare outcomes, and how can you speak to how NHIA can contribute to this?
Okay, so thank you very much for this opportunity. I want to say thank you for the NESG and also to the other speakers who have spoken so wonderfully about the topic that we have in hand. It really brings to the fore the importance of having strong regulatory mechanisms within the health sector to implement policies and reforms to improve the health indices of our people. It also highlights the advantages of integration as opposed to administrating a fragmented system with multiple regulators. We can be integrated even though we also are regulating different things, but we actually can take a cue from actually wanting to do things in synergy so that we're not necessarily in silos, but we're actually working together for a common cause. And I think that may be one of the things that may be lacking in some of the way we do our things. I want to thank Professor Adie for speaking so passionately about that. This obviously has implication for effectiveness and efficiency. Maybe we could think about harmonizing our regulatory frameworks. Dr. Obina said a bit about that. And we also know that we are unique as a nation, Nigeria, so we must develop strategies that suit our context and address our pressing health challenges, which we know may be larger than just having a uniformed regulatory body. We have the inability of many Nigerians to actually afford the needed healthcare services and the high levels of maternal and childhood mortality. So in strategies that actually address these will require basically a well-coordinated stakeholder approach. And that's why I think the coordinating Minister of Health and Social Welfare has hampered a lot on this sector-wide approach. So everybody does their bit, but it in a synergy that addresses the real issues that are affecting our nation's health systems so that we can achieve those goals that really are to save lives and reduce physical and financial pain. The first pillar of this new administration in the health sector is effective governance. And I think more than anything before, we need to develop strategies for effective governance to strengthen our regulatory capacities. I believe that each regulatory agency has its unique mandate. And what we need is, as Prof identified, is to actually hamper on total quality management. We need to have ourselves trained in, providing quality services. We need to strengthen our regulatory capacity to foster the highest standards of service provision. We must remember that the health sector is a complex system, and with our multiple regulatory agencies, one centralized healthcare agency cannot effectively take over the functions of every other all the other agencies, because they're multiple and they're the work that they do, their operations, their mandates are also multifaceted, and working together for one health sector, but again, they have their different things that they do to make the health sector provide the services that are required for the populace that we serve. The NHIA Act of 2022 is very clear about what we as NHIA are. We are a promoter, an integrator, and regulator of health insurance schemes in Nigeria without exception. So both the private, the public, the states, and what have you, any person who is actually doing health insurance in Nigeria is regulated by us. So strengthening the regulatory capacity of NHIA and other regulators in the health sector is an integral part of the health sector blueprint. The NHIA is keen into this to ensure harmonization of benefits, cost, and standards, as well as ensuring ease of portability, which is also a priority, because once we have it straitjacketed, then we're really not going to be able to do the things that we need to be done. And then, of course, promotion is very key, as many Nigerians really still don't have the knowledge of how they can assess care without additional financial hardship. This should be our focus, and together we can make it happen. And then to the quality question, a National Health Quality Commission. Again, the previous speakers have spoken a lot about quality. So within our own agencies, quality should be top-notch, and indeed in NHI, quality is the bedrock of what we do. We do assess the quality of both the health maintenance agencies, organizations, and also the health care providers. We are also strong on enforcement, which we have actually decentralized to our state offices to make it more effective. So quality is top-notch, and quality we must have. And again, I don't want to overflog this, because Prof has said so much about what we need to do to attain the quality that we need. So a quality commission, I don't know, that would be for the federal government to decide on whether we should have a quality commission. But more importantly, we need to support all ongoing quality initiatives in our individual agencies and ensure that there's a synergy, a sector-wide synergy, as dictated by a sector-wide approach, to make sure that we're working towards, the same cause of making health, providing quality health services affordable, with the right standards, with the right professionals in place, regulating every person who is providing a service to ensure that they're doing what they should be doing, and to provide that service even to our teeming populace, so that at the end of the day, we can actually say to ourselves that we're actually providing quality services. So the NHI, I'm sure, is supposed to support quality at every level, because, as I said, quality is our bedrock of and we do it in every area of our service provision. We speak it, we ensure that it happens, and we enforce it with our stakeholders. Thank you very much.
Thank you so much. Apologies, we're at time. We just maybe need 10 to 15 more minutes to wrap this up. So without any further delay, I'll ask the next question, Dr. Abiola Idu, who is the Executive Secretary of HEFAMA. Dr. Abiola Idu, are you on the line?
I'm on the line.
All right, apologies for the delay. So the question Dr. Benson would have asked if he was online is, so typically as HEFAMA, you kind of have a coordinating role. Would you agree that some of the roles of a number of other healthcare regulatory agencies or bodies are duplicated? And if so, how would HEFAMA support something more of a central coordinating body or entity, so to speak? I don't know if that question was clear. I'm summarizing from his question.
No problem. The question is clear. Thank you for inviting me to speak. And I also want to acknowledge all the previous speakers. Yes, I agree that there is overlap of roles among various healthcare regulatory bodies in Nigeria. And we recognize the challenge because that just as our healthcare providers feel that sometimes that there is double regulation. One regulatory agency will come asking for the same things. So, and this usually it results, in there are a lot of potential inefficiencies, and there's a lot of duplication in regulation. There's a lot of fragmentation, and it creates confusion amongst the healthcare providers, and they feel overburdened sometimes with duplication of effort. Saying that, I would also say, in order for us to actually say, I believe in one coordinating body, we need to also understand the aspects of regulation. So there are different aspects. Your regulation in terms of developing and implementing standards and guidelines that, for example, the healthcare facilities need to comply with. And then regulation in terms of regulating the practitioners themselves, regulation in terms of the equipment and the also the drugs and the pharmaceuticals. So there's regulation. We need to also understand the different drivers of regulation. So, for instance, if you're talking about regulation in terms of the drivers of the healthcare facilities coming together within a joint, like having a joint commission, yes, I would say that is doable. And it is something that that can be established. But we should also not remove the autonomy of the states, because there should be decentralization. One body probably controlling, and then the other, like the state actors carrying out the functions. But to have a joint regulation for everybody in terms of regulation of health facilities and providing the standards, regulation of the persons, and or the healthcare providers themselves, and then regulation of the pharmaceuticals. I think it will be. I'm not sure it is something that will work. I'm not sure. That's my own opinion. But regulation of the different drivers is something that can be considered. In a nutshell, that's my opinion. Thank you.
Thank you so much, Dr. Idowu. So without further ado, I'll just quickly take us through the questions. So what I've done is try to organize them into themes so we can get through them very quickly. Apologies if I've missed your questions. So we have 5 main themes. We have technical assistance for strengthening regulation. We have consumer or client perspectives, coordination amongst the different regulatory agencies, enforcement, and then I believe there was two very specific questions for NAFDAC, so 5 questions. So regarding the technical assistance for strengthening regulatory agencies, I think I'll ask this to Dr. Oyewumi. So an anonymous attendee had said market research was conducted, and about 90% of all healthcare business operators did not seem to know what the regulatory processes were necessary, to run a quality and compliant business in Nigeria. So we have come to see that documentation is the biggest problems and leads to delays. So what kind of support or what plan can be put in place to help businesses to become more compliant?
Thank you for your question. In fact, it's come at a perfect time, because, I was just thinking about the issue of the one body, everybody existing as one body. And maybe the question we should be asking is not necessarily housing everybody and bringing them under control of one body or making them all do one thing. Maybe the question we should be asking is, how do we get coordination amongst bodies that are similar or do the same kind of thing? So for instance, should we have something like a medical council or a clinical council that looks at professional bodies, where a council that coordinates professionals, right? So doctors, nurses, physiotherapists, everybody coordinated by this organization, such that we're talking to each other and we're able to make sure that we're not confusing the people that we're supposed to be helping. And maybe that is where we would have this kind of function you're talking about being hosted. There should be a coordinating mechanism, someplace where you're able to find the information you need, right? And some existing bodies may be able to take on some of these roles. So for instance, a HEFAMA, right? Is there a place for HEFAMA, for instance, to have all the requirements for healthcare organizations to be able to operate in one website, on one page or something? Should they be able to see and help organizations, because they are regulating organizations, they are facilitating the delivery of good care? So can we have a way of bringing all these things together in one place, all the information that you need on one page? Is it a place somewhere in Ministry of Health where you go and you find out that for you to be able to operate a hospital, you need A, B, C, D up to Z, right? I think that would be useful. And then to think about the coordination mechanisms so that we're not duplicating. I was really touched by Professor Diaz's impassioned delivery. And yes, maybe if we take out all the personals and think about how do we really support the organizations, we will be able to come together and talk. So I think I would submit to you at this time that we should be thinking about coordinating organizations or coordinating mechanisms rather than just subsuming every other organization under one. Thank you.
Thank you so much. I'll ask Dr. Benro. I think there are two questions for you. One is how to handle some of the challenges that may arise in terms of governance, decision-making, and maintaining professional autonomy. Given that there's existing rivalry between the different professionals. I think that's well known in the health sector. So what kind of challenges might arise in terms of governance, decision-making, and maintaining professional associations, and what are your recommendations? Now, this is in terms of coordination, not necessarily an independent body. Sorry, you're muted.
Thank you very much for that question. In terms of challenges that professional bodies face and the effect this has on interprofessional rivalry, I would say the solution is for all the professional bodies to come together. The Medical and Dental Council of Nigeria, the Medical Laboratory Science Council, Nursing and Midwifery Council, pharmacists, and all the other 14 health regulatory bodies. They should come together. There should be that sync between all of them, because the reason why they are there is to serve the people, is to provide quality healthcare delivery to the citizens. And if they are not together, it then means that the patient, the citizens, suffer for this. So they need to speak together. The healthcare sector evolves around the patient, the institution, and the practitioner. So all these three must come together. They must align. One solution I would prefer is that we as a country, and this is personal, this is my personal opinion, I think for the health regulatory body, there needs to be that central umbrella. I think it has come to a time where we all need to come together. Coming together doesn't mean that we are going to be encroaching or doing what other health professionals are doing. No, it means that there's going to be that central coordination. I don't think the structure we have right now allows for that coordination to happen. So I think we need to do that. And then we need to look at the current enabling law, where the councils and the board, the regulatory councils and board, are only concerned about the practitioner. We are not directly involved with the environment that the practitioner practices. It's a concern, because the structure we have right now does not allow us to do that. There are very few states that aligns with the federal when it comes to this regulation. And the Lagos State, for example, is one good example. They're doing a fantastic job at pharma, right? But we can't say that for many of the states and the FCT. We can't say that for them. And that is where the challenge of regulation that has to do with the practitioner comes in. Because many a times when we try to collaborate, partner with many of the states, we don't get that support from them. So it's a huge challenge. So I think, one, there needs to be that central coordination among all the health regulatory bodies. And then we need to look at our law to see how can the health regulatory body play have a more direct impact or role with the facilities. This way, we'll be able to reduce a lot of these conflicts that happen within the healthcare sector, and then which now affects negatively the patient that we're supposed to be caring for. So that competition between regulatory body A, B, and C would all be eroded if there's that central coordination. I think that is where the main issue is that every regulatory body wants to feel more superior to the other, forgetting that they are supposed to be caring for the patient. So one is the central coordination, and also looking at existing laws and policies on how the regulatory body could effectively partner or collaborate with the states to ensure that they have a more, they participate more, in what goes on in the health centers. Thank you.
Thank you so much. So a quick question or series of questions for Dr. Nermeen from Egypt. So we had a question from Wilson Babangida Agboti. He's asking about, in terms of how a regulatory body can ensure independence from political influence. And then if you could also speak on the current enforcement mechanisms that you apply in Egypt. I don't know if you're still on the line, Dr. Nermeen. Go ahead, Dr. Nermeen. I see you're unmuted.
Yes, hi, can you hear me?
Yes, I hear you now. Thank you. Did you hear the question?
Yes, I have heard your questions.
Okay.
Okay, let me start by answering the enforcement of the healthcare system. And to fully grasp the strengths of the healthcare system, you need to essentially acknowledge and address the challenges encountered during the system redesign. The introduction of a completely new system, such as universal health insurance system or any health insurance system, usually must face several significant obstacles. That includes social, financial, administrative, and mostly cultural issues. These challenges that we faced in Egypt's healthcare system were effectively addressed through a combination of strategies. We had to do a capacity building programs, strategic planning, and quality-oriented approach. Moreover, we were faced with one notable challenge, which was overcoming patient resistance to viewing primary healthcare facilities as the primary entry point for health services. This resistance was addressed through community engagement. Extensive efforts were made to engage the community, including cultural changes, initiatives, awareness campaigns. These initiatives highlighted the benefits of the pre-booking hotline system and how it reduced the waiting time, and it also built and robusted the trust. It depended on trust building through establishing open communication channels and fostered trust. This helped to transform previous negative perceptions and experiences into positive outcomes. Eventually, the strength of the health regulation in Egypt, we can say it was attributed to finalizing the service packages in all hospitals, attracting top-tier medical and administrative talents, mass automation and digital transformation qualifications for accreditations from both national and international bodies, establishment of a beneficiary satisfaction department for the first time in healthcare system in Egypt, with diverse communication channels and mostly, or the most important point was the community participation access. I want to add one more thing. It is widely recognized that unity is strength. Therefore, from this esteemed platform, I propose the establishment of an African Hospitals Federation. This federation would serve as a crucial network connecting healthcare leaders across Africa, empowering them to collaboratively address modern healthcare challenges, epidemics, and respond effectively to all that we face in modern life. And thank you.
All right, thank you so much, Dr. Namin. I think we got quite a lot of insights. Just staying with one idea you shared, which is on beneficiary satisfaction, I'll ask Dr. Idowu a question on so relating to consumer or client perspectives, and then we'll wrap up. I'll hand over to Dr. Benson. So one attendee had noted that the consumer perspective was missing, and I will agree with them. So how does HEFAMA tend to, incorporate consumer or client or beneficiary feedback in the work that you do? If you could just share some thoughts with us before we wrap up.
Okay, thank you very much. So I would, before I say that, I just want to quickly add that Dr. Oyewumi mentioned that there should be like a central place where the healthcare providers can access information on the requirements for health facilities. So we have a website. And it is that website that we expect healthcare facilities who intend to register to access information from. Okay, so that website is also interactive. One, we give out information to the general public. That is not to say also that we do not realize the fact that in the past we had been engaging so much with our healthcare providers, not engaging with the general public. So in 2022, we went out to campaign, like sort of have town hall meetings and then community awareness blitz so that we can engage the public. And the major message is do not go to health facilities that are not recognized by government. So we have a logo. So we tell the community leaders to help us propagate the message to the community that they should only visit facilities that have logos. And then we also say that if they have gone to any health facility and they feel displeased, or they feel that the health facility is being run by unqualified persons, they should tell us. And we send out our social media handles, and then we also encourage them to speak up. They can go to the Ministry of Health, they can send us text messages, and it can be anonymous, and we go from there. I hope that answered your question. Thank you.
Yes, thank you so much. Apologies, we couldn't go into all of the questions, but I think we've touched on them one way or the other. With this, I hand over to Dr. Benson to just wrap up. Dr. Benson, are you on the line?
Yes, I am here. Thank you so much. And I want to thank also all our speakers today for your insights. It's an ongoing conversation. I just also want to at least go through some of the key points that came out of the conversation today. Our aim will be to further the conversation from now, after now, and then see how we can encourage government to form some policy direction around these conversations. So we are agreeing that there is need for interagency collaboration so that each of these agencies, regulatory bodies, are not working in silos going forward. We are also saying that training and capacity building, human capital development, very important in getting these agencies to function optimally. We also said at least Prof alluded to the fact, Professor Mojisola alluded to the fact that we should be able to eliminate corruption from the system, because, giving example from what she met at NAFDAC and working on, some of the corrupt practices that were inherent in the system, she has been able to leapfrog NAFDAC to, 3-4 different levels. We also have to be intentional in quality, in developing a quality mindset in all these regulatory agencies, so that the first key point is to ensure that by the time we are done with regulating the environment, the patient should have quality healthcare outcome as the benefit. And the overarching thing we also kept hearing is the fact that, yes, there is need for central coordination. I think the question then is, as they always say, who bails the cat? Who handles the coordination? From where should the coordination emanate? And all of that. So these conversations we're going to be having internally. We're going to be reaching out to most of you, from time to time going forward, as we try to shape our next steps. But our target remains to have better and strengthen the healthcare regulatory environment that is smart, that is agile, that is also robust, in that sense. And we like the fact that IFC also has some level of funding support, depending on how the funding is requested and how they can deliver. At least there's some level of funding support that they can give to programs, like trainings, capacity building, and the likes. They are open to this type of conversation. So we will bear that in mind as we take the conversations forward from now. So thank you. Let me call on our facilitator, our able facilitator, Dr. Maurice Atoke, to give the closing remarks. Dr. Maurice, over. Thank you.
Thank you so much, Dr. Benson, for a fantastic moderation and anchoring of this very important pre-summit. And to all of the speakers, I think it behoves of me to really, really extend my appreciation on behalf of the Nigerian Economic Summit Group Health Policy Commission. Mine is simple, it's just to really give closing remarks, and on behalf of the board and management of the NESG and the leadership of the Health Policy Commission, I hereby give my closing remarks of this pre-summit, again titled Strengthening Healthcare Regulatory Bodies in Nigeria, hosted by the Nigerian Economic Summit Group Health Policy Commission. A lot has been said today, and you would agree with me that it was a very stimulating, almost emotional, enriching and very insightful session, as all of the discussants shared insights that will guide our strengthening of Nigeria's healthcare regulatory bodies. Regulatory bodies indeed play pivotal roles in safeguarding public health and in ensuring the quality of healthcare services. But notwithstanding that, we recognize the multidimensional challenges that each one of you, especially represented by the agencies that the panel came from today. We recognize that the challenges that you face in fulfilling your mandates effectively, from limited budgets and insufficient funding to inadequacy of staff, limiting your capacity to conduct thorough inspections and enforce compliance. That is in addition to the persistent uncertainty resulting from the weakness in the regulatory oversight, which discourages domestic and foreign investment in healthcare infrastructure and services in our beloved country, Nigeria. Without doubt, and in alignment with the overarching theme of the summit, scheduled to hold on between October 14th to 16th of 2024, themed collaborative action for growth, competitiveness and stability. I think the topic today also really quite done justice to just really earmarks our efforts to collaborate for action and for growth in a very competitive world. The overarching topic is aimed to focus on the imperative of accelerating economic development and transformation. And therefore, addressing all of the challenges that we have spoken so eloquently around today requires urgent and coordinated efforts from each one of us. I mean, Prof really nailed it when she talks, directly to all of our efforts. Our efforts are required to strengthen the institutions, to enhance capacity to enforce standards, and to foster an environment which is conducive to sustainable healthcare development. I did hear Dr. Mani from Egypt talk about the need for everyone to be heard. I think that's also really quite key in these conversations as we move forward. With certainty, the insights gained from our panel of experts today will be instrumental in developing a clear path towards these goals. Today's discussions discuss the need for more resilient regulatory bodies in Nigeria to match the much challenged healthcare system, from focusing on addressing funding gaps, integrating innovative dimensions, to improving coordination and the potential of a centralized authority to streamline regulation and enhance outcomes. To what tangible actions that other African countries have implemented that can be studied and explored for replication. Our commitment as a commission, I talk about the Health Policy Commission here, is to work optimally with all of you gathered here today, of course, with both the organized private sector and the public sector, to strengthen our regulatory bodies and in their capacity to strengthen the healthcare system. Today, I extend my profound appreciation to every speaker, to every discussant, and to every participant who made our time to join us today for this very important topic. And my more profound appreciation goes to our keynote speaker, Dr. Abdul Mokhtar, the National Coordinator of the Presidential Unlocking Healthcare Value Chain Initiative, domiciled under the Federal Ministry of Health and Social Welfare, for honoring our invitation to this free summit. Indeed, this is a demonstration of their commitment to engage, to collaborate, and jointly unlock the health value chain of Nigeria, working with all critical stakeholder groups. Finally, I would like to urge every one of us, again, to register for the 30th Nigerian Economic Summit through the Nigerian Economic Summit Group website, to join other experts and stakeholders in continuing this conversation, in putting health at the front burner, and in articulating an agenda for collaborative action for growth, competitiveness, and stability. May God bless the Federal Republic of Nigeria, and may God bless all of you here today. Thank you for your esteemed attention.
Thank you, Dr. Morris. That was some the closing remarks from Dr. Morris Atuki. So with this, we've come to the end of the session today. And I want to thank everyone again for your time. It has been 2 hours, 30 minutes well spent. And like Dr. Atuki said, we will continue this conversation and we'll take your insights as we build on the next steps. So have a nice rest of your day and God bless everyone. Thank you so much. Also the Secretariat, the NESD Secretariat, thank you for all the technical support, having the platform on and managing the meeting in entirety. God bless you all. Thank you. Bye-bye.